musculoskeletal, is it osteoporosis? I just wanted to alert people like you. It may be osteoporosis. Maybe. So what is osteoporosis? Osteo means bone cell. Osteo means bone cell. And porosis, pores. Pores in the bone. When we have pores in the bone, we call that bone as osteoporosis. Or you can say thinning of bone is also osteoporosis. Osteoporosis is a silent killer. It is very common in women. Like 70% of the osteoporosis patients, 70% of the patients are women. 1 in 2 women, or you can say 1 in 8 men over 40 will have osteoporosis. Then the estimated cost for the osteoporotic and associated fracture is 38 million a day. 38 million rupees a day. So what is it? Disease in which the bones become fragile and more likely to break. There are pores and the bone is more likely. Break usually occurs in the hip bone, backache, spine, again the full back, and wrist. Okay. These are the common sites. Otherwise, you have pain in joint also, and what you call it musculoskeletal pain. The musculoskeletal, the pain throughout the body. The muscles are there, so the bones are there. Musculoskeletal. Hip and spine fractures are major concern. Hip or spine, it is major concern because spine contains spinal cord. Most of the time there is hemiplegia or paraplegia. One leg is not possible, both the legs are not possible. There is a spine. At different level you have different nerve supply and then you have different complications. Now hip fractures almost always require surgery and hospital. It cannot be corrected at home. Spine fractures have serious consequences such as loss of height, severe backache and deformity. What causes osteoporosis? When we are young, we consume a lot of calcium, and this calcium will go and get deposited into the bone. The bone likewise becomes thick. After the age of 20 or 25 years, regeneration of the bone takes place, or calcium utilization or calcium consumption is less and the calcium utilization is the same. When the calcium consumption is less and calcium utilization is more, or you can say same, then the calcium level of the bone starts lowering down, getting lower. As we get older, the process slows down and you start in the bone growth. Process of generation. Forming of bone starts slowing. The process is slow. So the bone forms, the formation of the bone is slow. At the same time, calcium intake is less. The risk of osteoporosis depends on how much bone mass you attain between the age of 25 and 35. When a pediatrician was asked, how much calcium should I supply to my child? He said, कब तुम्हारा बच्चा बूढ़ा होना चाहिए, it depends on that. अब जितना ज़्यादा कैल्शियम उसको दोगे, उतना लेट बूढ़ा हो जाएगा. So the idea behind it is the more calcium you consume at the age, till the age of 25 or till the age of 35, where all the hormones are secreted in the body and most of the calcium can be absorbed. Maximum calcium should be taken. Risk factors. Again, risk factors are female, very common. Female has got chances of getting osteoporosis more. Then thin and small frame. The person is very thin, small frame है. So the bones are otherwise also tiny. और फिर उसको और thin हो जाएंगे तो then it is more of osteoporosis. Advanced age, as the age grows, osteoporosis is common. Family history of osteoporosis, my father is got osteoporosis, probably I may get osteoporosis. Then post-menopause, this is a very common factor, post-menopause in women. Now risk factor is also anorexia nervosa, where you have low appetite. Then diet low in calcium कम होगा, ऐसा डाइट खाते हैं तभी भी there are chances of getting osteoporosis. Low testosterone level in men, inactive lifestyle, sedentary lifestyle कुछ है किसी का ज़्यादा घंटा नहीं ऑफिस में बैठता है, no walking, no morning evening walking, ऐसा भी कुछ नहीं है. तो then sedentary lifestyle जो रहता है और inactive lifestyle है उसको भी osteoporosis common है. Cigarette smoking, excessive use of alcohol, being Asian. Now Asians are also getting this osteoporosis very common. Now are your bones healthy? So we have to check. I cannot say I am strong. Okay. Now these days you see osteoporosis very common as in the female, as it is common because of hormones. Menopausal age has come from 50 to 30, 35, somewhere there. Surprised to know that a lady of 30 years is also at menopausal age in this era. Maybe because of so many other factors, diet factors and all. Plus, these girls, they go for dieting. Or they don't understand what is dieting. Let me tell you frankly, they don't do dieting, they do fasting. There is a great difference between fasting and dieting. Dieting means eating things, proper interval, adequate quantity, and wide variety. That's not dieting. But people, what they do is, all these girls and females, what they do is, they do fasting. They don't eat only. So when you don't eat, when you don't consume calcium or other minerals, definitely that minerals will get level. Bones are living tissues. They provide structural support, protect vital organs. Brain is there inside the bone structure. Tongue is again in the bone structure. Eyes again in the bone structure. Heart again in the bone structure. All these vital organs are in the bone structure. Until age 30, we store and build bones effectively. Until the age of 30, we store and we build bones effectively. As part of aging process, bone begins to break down faster than they are formed. As age grows, bone form होता है उससे ज़्यादा bone degenerate, accelerate after the menopause. Menopause women को हो गया, hormone level, hormone change हो जाते हैं, those hormones are not secreted. That is the reason why this estrogen, by the hormone name estrogen, is that protects against the bone loss. Then how do we come to know that our bones are weak? We have to go for bone density test. Can detect osteoporosis before the fracture occurs, then predict your chances of fracture in the future and determines your the rate of bone loss. And once this test will tell you whether you are osteoporosis, whether you are approaching towards osteoporosis or you are bone mass density. You use medication that cause osteoporosis. You have type 1 diabetes, liver disease, kidney disease or family disease. You experience osteoporosis. You are post-menopausal over 50 and have at least one risk factor. Risk factor is again this diabetes, liver disease and all. Then you have post-menopausal over 65 and never had test. Bone. Then prevention. How do we prevent? With strong bones in childhood only, and adolescence is the best defense. So if we have not done, or if it is not done for us, we can do it for the next. Then a balanced diet rich in calcium and vitamin D. Then weight-bearing exercise. Then healthy lifestyle with no smoking or no alcohol intake should be excess, no alcohol intake, bone density testing and medication when appropriate.